Let's jump to second year, first semester. What was there?
Second year, first semester. Just trying
Yeah.
to cast my mind back to
Yep.
then. We have back then. I think it was MS4, so further progression of musculoskeletal,
Hmm.
looking at
I like.
a bit
I'm
more
happy you didn't say MS5 because it's not an MS5. But yeah, MS4. Yep.
MS4. So looking at how surgeries influence your management or
Mm-hmm.
influence the recovery time frame of patients. So looking at your total shoulder arthroplasties, your hip replacements, your knee replacements, what kind of precautions you're looking at, what happens at a physiological level, what changes would you expect certain time frames, how can you take that into consideration in influencing your management. Also, this was there in MS4. That was the main aspect that I can remember, like just looking at different operations
I love this
and
because yeah. I teach MS4 as well, but so you're definitely right. There's definitely post-op stuff in there. There's other bits and pieces, but yeah, keep going, keep going.
yeah. With MS4. Jeez, I my memory's shocking with
You're
MS4.
not the only person that I've spoken to over the years that's kind of had the same type of answer. So I'll fill in the blanks for you in a sec, but I really want to just put you on the spot there and keep trying to remember what
That's right,
MS4
okay.
was about.
What else we got? I think there was more special tests involved as well, and
Mm-hmm.
also like your neural tension tests. So looking and differentiating between like your NRCs, whether there's something that's a bit more like hairy going on, like a quarter recliner or something like that, just to
Mm-hmm.
narrow down on what's going on there. What else is going?
Now I think you got it. Yeah, so MS4 is kind of like, and for those who are in the undergraduate, MS1, 2, 3, 4 is basically your foundations, and then MS A, B, C. So they're not exactly the same units, but a lot of it has the same content because you're both becoming physiotherapists. So they should be. So for MS4, which is equivalent to MSc for the majority of it, yes, has post-op stuff. It's basically kind of putting together more advanced clinical reasoning. So people who kind of develop that skill of thinking critically, which you did say that the undergraduate really helped you develop that. The people who have that generally don't get phased by MSc or MS4 as much. So basically, yeah, you got your post-op cases. In other words, you know how to assess someone normally, but what if they have an operation? How does that change your cookie cutter build? Um, what if you have someone with shoulder pain and neck pain instead of someone with just shoulder pain or just neck pain? Uh, what if it is something to do with the nerves? That's kind of a bit more complicated. So it actually is often hard for people to remember exactly what they've learned because it wasn't really a particular area of the body. It really was developing this problem solving skill with different types of cases, which I think you kind of touched on the key different areas quite well, actually. Post op, nerves, and I'm not sure if you said it, but yeah, what if people have kind of two different types of pains that kind of influence each other?
Yeah,
Mm.
and acknowledging that unlike uni, there's most real life cases are very complex. They've got a lot of comorbidities going on. They've got a lot of other issues in other structures that may tie in with why they're presenting today, and
Mm-hmm.
kind of understanding that things are never always as it seems in the same like in the way that they're taught in uni, where we're just looking at this structure in isolation, but generally there's tons of stuff that are linked together that you might not otherwise see at first glance.
Yep, that's good. Now, surely MS4 wasn't the only thing you did in year two, semester one. Can you remember anything else?
Oh, what was the other one? Ooh, I feel like there was the sports one, sports physiotherapy, I think.
Yep.
So it was looking at your like if someone's injured on the ground, your toe taps assessment, going up to
Mm-hmm.
them, making sure that they're not concussed or what kind of level of injury you believe that they're at, and making sure that they're getting the services straight off the bat if you think it's something serious or if it's a complete tear or a potential fracture,
Yep.
triaging them straight off the bat. So really thinking quick on your feet. That was the main thing that I
Yep.
got from that course.
Good. Yeah, the sports component was a big component. The second unit so the other unit of study you were doing so this is the sports unit. Sports wasn't the whole thing. There were some other little areas. Can you scratch your
Ooh,
brain and think about what else?
what else was there? Sports. It's
So
not coming to me. The sports one stood out more to me. I recognize that sports is half of it. I can't remember. It's
yeah, do
completely
you
escaped
remember
me.
stuff about occupational health?
Oh yeah, yep. So
Yeah,
your ergonomics, what's considered good lifting,
yeah,
looking at certain degrees, so like your neck, your back, especially with like your workers, like later on if you go down allocation or oh sorry, if you go into private practice, your
yep.
workers' compensation, understand
Mm,
what's good lifting technique, good lumbo-pelvic rhythm, all those little, all that type of jazz, kind of establishing what's considered good form earlier on.
yeah,
I think that's the general gist of what MS4 taught after
yeah,
sports.
yeah. I can't remember. Did you learn hand therapy yet?
That's oh like your I think so. There was like very small references to like let's say Watson's test or your scapholunate ligaments and
Yep.
uh yeah, along those lines I
That
think.
was yeah, because you haven't mentioned many placements yet, so I think that's the next part. So I'm just trying to because I sometimes get confused in the undergraduate and the GEM, so the graduate program you did on exactly the schedules. But
Mhm.
yeah, so there generally is a subject that it's a bit of the hand therapy, which is a special. You can even specialize it in physios, where yeah, the hand is, if anything, in anatomic anatomy wise, the hand is super damn complicated. So hand
Mm.
therapy, yeah, is actually worth the extra study. Then you got your sports, as you said, occupational health. There should be something else. I think it was community health as well.
Oh yeah.
But you might have lumped it with the idea that you got a sense of complex cases, meaning what if it's not just musculoskeletal? Yeah.
Mm.
I mean, we've been talking a lot about musculoskeletal because one, I'm a musculoskeletal practitioner, and two, um, you sound like you have a big interest in that too. But yeah, but the other side of it is people can have multi-system issues as well, and that's where you get some of those cases to get you ready for the next semester. So yeah, that was a good segue, I think. What was in the next semester? That technically the final semester of that 2 year degree.
Ooh, final semester included writing a research report, so like your thesis.
Mm-hmm.
They'll give you a case and then talk about how you'd approach it. What does the literature say? How would you break it down considering all their little comorbidities that they've got? How would
Mm-hmm.
they influence your management? And just kind of structuring all that together. How would their rehab play out logically from your perspective, taking in consideration all of that? That was, I think, the research write-up.
It
Other part,
was. That's right.
yeah, that part. What else do we have? We had a cardio assessment that was in a group work. So looking at your like pathophys, understanding what's going on within the lungs,
Mm-hmm.
and writing down like what's happening if you have like a oxygen insufficiency, a cardio, or like a carbon dioxide insufficiency, those type of parts,
Mm-hmm.
segues. What was the last one? I think the last one was your advanced physiotherapy, which was looking at your different schools of like practice. So your Maitlands, your Mulligans, your MDT.
Okay. It,
Uh,
it it touched on a lot of that, did it?
yeah,
Okay.
so
Yeah.
like
Good.
briefly, but it just showed you that there's these different trains of thought out there.
Mm.
Um, there's some people that will like work under like one school of thought and just that, but at
Yep.
least what we were taught in uni was kind of like cherry picking bits and pieces here and there and kind of creating your own way of treating within like a musk area.
Yeah, or the analogy I like best, which I think I said last stream, was think of it as a toolbox. So you've got your
Yeah,
three
yep,
different tools. You don't need to make it into a Swiss knife approach where it's the one tool that does everything. You just need to know which tool to take out for what, and maybe sometimes you need two or three of them instead of just the one.
that's it.
Cool. So yeah, that's good because I was always wondering where exactly, and I keep forgetting. So it's just me being bad about where exactly was Mulligan's taught. And obviously, a lot of the stuff we've learned was Maitland based. And then
Mm.
you've also talked about Mackenzie, which is the MDT. Yep, I'm pretty sure that's what you mean by mechanical diagnosis and
Yep.
treatment. Yep, which is what we often known as Mackenzie. So cool. Now remind me, because you haven't mentioned anything about placements, and you're definitely correct. Before we get to placements, yeah, there was that research unit which helped you kind of flesh out how to read research papers, hopefully be critical of it as well, don't take it as face value, and then how to apply it to a case, which is ends up being a report. So sounds like you clearly remember that one as well, and I clearly remember that because I taught that a particular subject. I haven't taught the other one we mentioned. So yeah, where do order placements fit in? Where does order, like, you haven't mentioned any clinical experiences at all yet. So for someone who's listening, going, is it all just coursework? When do I actually get to see a patient? Yeah, when did that happen? Or when did things like that happen?
So all our placements started in our second year. So you could have started treating or seeing patients at least as early as the start of your second year of your master's. During that time, you could be allocated or placed either in a hospital or in a private practice. Personally, I got placed in a private practice for my first one. And that was mainly like a general type population slash sports, which is pretty common across all private practices that you'll come across mostly.
I agree.
During that time, so I got sent over to Orange, so rural placement.
Oh, yeah.
That was a very good experience. I'd highly recommend if you ever get a rural placement to take that opportunity. Like, it will show you a different way of life or a different way that communities engage with physiotherapy that you won't really see if you live in a metropolitan area.
And you're with the... Oh, sorry, I talked over you. Keep going first.
And also, like, let's say how telehealth plays a part in reaching people that are very, very far out in the sticks that generally have no other health services around them.
Yeah. So, was that with the, I was going to say Dubbo, but you mean, was it Orange-based hospital?
It was Orange-based private practice.
Private practice, okay. Because I've been to Orange before, and their hospital is Orange. So I'm not sure if you ever swung by it, but have you seen it yourself?
I can't say I have.
Yeah, it's not like completely orange, but it's kind of got this grey, or from my memory, I might be wrong, but I clearly remember the building being quite orange, which is quite fitting. It was, how long ago was this? This would have been about, 9 years now. And it was technically a brand new hospital that back then, so it was super shiny and orange. Anyway, I think you're smack bang on the money there in terms of the benefits of this rural placement, where you kind of see a different perspective, how physio might be a bit more of a generalist, where telehealth happens not because just of COVID, but because people are just really, really far away. So yeah, that sounded like the first two placements you had in the year, and then you had two more later on, or how many more to?
I had 4 other ones. I had another one that was in Liverpool. So that one was in Liverpool Hospital for outpatient MSK and outpatient neuro. Those ones focused mainly on your total knee replacements, your total hip. And during that time as well, because early COVID, a lot of the initials were taken over the phone. I guess the biggest part that I took from that was like there was a lot of multicultural like elements that engage within that community. So you had a lot of non-English speaking backgrounds. So considering that communication, you need to be very precise with what you're saying and make sure that they're on board and they understand where you're coming from, and just using body language, using like interpreter services, trying to find different ways to communicate what needs to be done or how you're going to approach the situation, making them feel comfortable with you. And yeah, I would say that was probably the most challenging thing with that.
It's because what languages do you speak again?
I speak English and Mandarin.
I was gonna say, if you just said Mandarin, so you can speak English too, but you can say but you had other languages, a lot more other languages that were required at Liverpool, I'm guessing. And guessing you had to use interpreters or translators. How was that?
So it was very, very tricky, I find. Like, sometimes the patient would kind of go off on a tangent and they'd have a mini conversation with the translator. You kind of just wait for it to play it out, and then the translator might come back and just say like a few words, and you're like, hang on a minute, you spoke for like 2 minutes. Come on, you had more to talk to me about than just that.
Yeah.
That element, or sometimes the translator just booking a time where they're free, that just adds another variable of RNG, whether it lines up nicely with your patient. Like sometimes that's not the case, and you're gonna just have to find another way.
So your gamer side is showing. You just said RNG.
Gee, yeah.
Yeah, the randomness of it. Yes. So yeah. Fair enough. Yeah, and remind me, because this is oh, we'll get to it in a second. But like, last year, which was the second year of this course, it was, throughout COVID. Now, obviously, these placements, you were there physically, and then you've had some of these units that were not. But we'll get to that in terms of online versus, because you had both. You had the normal way that was normally taught, and then you guys kind of experienced COVID when you're like halfway through the course. So, well, that's another question later. We'll stay on the topic on placements. So, Liverpool, and then what was next? What was the remaining one?
After Liverpool got placed at Westmead, so
Yeah.
Westmead was acute geriatrics, which was very interesting and tricky as well. Like, there's a ton of comorbidities that you have to take into consideration with that population, and you're always constantly informing with the medical officer or the medical team, like medication management. If you're working with a patient with Parkinson's, I
Yeah.
remember one case where a gentleman had like their titration was incorrect, and like that vastly changed how much he'd like respond to certain stimulus or how much you could get out of certain treatments. Like sometimes it'd be non-receptive whatsoever, and you just kind of have to accept that and document what was happening.
Yeah.
Other times he'd have a great day, you get through all you wanted to do. So yeah, just seeing how other disciplines influence how much you can do as well, and just kind of humbling yourself that, yeah, that's all I can do today, and
Yep.
kind of just, yeah, leave it at that and document it down.
Yeah. Oh, no, that's really good. I think it was actually good that you had this placement toward the end, because yeah, it's complicated. You there are things that you know. Oh yeah, this will be the ideal way of doing things, but then all these spanners get thrown into works because, yeah, maybe their medication wasn't quite optimal, or something happened during the day of the week, or there's other bigger problems besides moving and pain. Surprisingly enough, they're sometimes not the main problems. There's other bigger problems that need to be addressed first, and you're one piece of the team in the puzzle. So I think, yeah, having the experiences you had before having displacement actually probably made it a lot more easier. I mean, I'm guessing, like, imagine you flipped it around. So imagine your private practice and your Westmead one that you just had was switched around in places. What would you feel about that?
I'd feel incredibly overwhelmed.
Yeah. Yeah. So of course, people get placements by the luck of the draw.
Yeah.
But obviously you got the what is it? The long stick. The long stick is the good stick, isn't it?
That's it.
The short stick is the bad one. So okay. So we went through a brief overview of your placements. For those who are kind of studying at the moment, yeah, most people listening probably are. What would your tips be to survive clinical placements?
Okay, let me pull this one up. I made a little list here.
Yeah, you did. Okay.
I would say number one on my list is being a team player and trying to fit in as much as you can with the workplace culture. So just trying to help out where you can, and like not, how do I say this, being a bit of a self-starter, taking initiative to help out. A lot of people take notice of that and are more likely to help you out as well. Like, there's one thing just being a student, just kind of being a fly on the wall and just learning. There's another thing, you get a bit more experience as well. Just got to put yourself out there a bit more and engage with what's going on, and like also not do anything dangerous, but where you can do something, just do your best to, like, give it a shot, give it a crack. Say that.
Yep.
What else we got? So understanding also your responsibilities as a student and as a physio. So like making sure to do what you can, but also managing to stay in your own lane per se, like, and to avoid and that's mainly to avoid feeling overwhelmed. So one of my clinical educators gave me this brilliant advice where it was the only one that can take away your registration is yourself. And that's incredibly powerful. Like no one else in that hospital can. It's up to you to hold on to that registration and to protect it. And that's to make sure that you're safe, the patient's safe, and you're not doing anything that's outside of what you're supposed to be doing. That part. And also, I'd say another element of placement was like creating a daily or a weekly reflection sheet. So this was just to show you like an overview of the skills that you developed, any interesting cases you came across, what you found challenging, what you did to those challenging situations, and consider if there were any other better ways of approaching it. Another aspect was have a very strong support network. So make sure to keep in touch with your friends, talk it out with them. Don't try to harbor all of the things that are going on that might be confronting or shocking or challenged you a lot. And also being like, continue talking with your family. Like that's also very important, and being connected to them. And scheduling time for yourself to unwind with your hobbies, play some games, talk with friends, do those other social parts, because even though you might not be working per se on placement, you're giving yourself that downtime that you really need to be more efficient and more sharp when you go back into things. So making sure that you look after yourself, that's probably my biggest like advice to it, really. Like making sure that you're good, you're safe, you're in good spirits. That's probably it.
Yeah, and it sounds like you had some great clinical educators along the way, and none of them were me. So yeah, so I'm not tooting my own horn here. This is other people that don't name them, but like the people you've been with have been really great to you. So if they ever come across this, maybe they can give themselves a pat on the back. But I wish I heard all that stuff you just said when I started my placements. I think I did some of those things, but yeah, no, it's actually would have been really helpful if I knew that earlier as well. Maybe it was said and I just wasn't listening. So yeah, you heard it now though, everyone who's listening now. So take all those points. All right, then obviously you made it through. You made it all the way through the last placement, which finished about a month ago, which then gave you the stamp to go, look, you're done with the degree, and now you're about to graduate. So just before we talk about what's next, yeah, I mean, first of all, why, like normally your degree is in 2 years. Why did it end up in June, 2 years and a half? It doesn't sound like you failed anything by the sounds of it. So how did that happen? Which will kind of lead on to like, what was learning stuff like during COVID?
Ooh. So story time with that. Basically what happened was I was also sitting the MS4 exam earlier on in 2020, and the exam ended up crashing on me 3 times in a row, and that was on server side, not on my side.
Okay.
So basically I'd only been able to get through about 40 minutes worth of the exam, and assuming that I got all of that right, I still calculated, and I was like, that's not enough to like pass it even. So I had to apply for special consideration and push that through, which took time. And by then, like the placement rounds had been either taken or due to COVID just stopped. So I had like a 2 to 3 month intermission of just, there wasn't any uni, which might sound good on the outside, but on the inside it was pretty like, I guess it was pretty frustrating because like your other cohorts all moving along, and it's like due to no fault of your own that you're kind of in that situation.
Yeah.
But like trying to make the most out of that time, being productive, just learning other life skills that will help you out. So,
Yeah.
for instance, I picked up a bit more gym, picked up a bit of cooking, just to kind of fill the time, really, and of course games.
That's right. You were telling me on one of the streams a list of different things you've learned to cook, which are quite amazing, actually. Like shepherd's pie and whatnot. So that's when you started learning all that stuff, did you? Yeah. Cool. But yeah, no, sorry to hear all that. Yeah, so like you said, it wasn't your fault at all. Things were out of your control. But if anyone hasn't told you this, what it seems like you demonstrated is definitely resilience and persistence. You probably sounded like it was a frustrating and tough time in those 3 months. But sometimes, like for some people, that would just completely stop them in their tracks and go into a spiral. But you picked yourself up, got the things done, and congrats, you're now finished in June. So in other words, one placement was kind of not happening, and then after your last one that should have finished, you had to have a bit of a break until you could slot into another one. Like when was the placement before the one you just did?
Or the one that I just did.
Yeah.
So I think the Will team organized for me like 3 placements in a row. So it was like from one hospital to another hospital to another hospital. So it was like back to back to back.
Okay, wait, so
And
if
that
we
was,
go backwards, so you just finished in June in your placement here, and then they
yeah,
go for about 5 weeks, right? So let's say, then what was right before that? Was that another placement?
yeah, that was another placement.
And then another one right after that?
Yep.
Yeah. Okay, so you went through kind of coursework. You might have had a little bit of a summer break, I'm guessing, and then you went straight into 15 weeks.
Yep. That's
Okay,
it.
yeah. Ah, good on you. Yeah, good on you. So obviously those tips work, because that's probably as hard as you could possibly get in terms of how placements go 15 in a row. Some people get the lucky, 5 and 10 or 10 and 5, with the break in between. So I believe I had a 10 break and then a 15, but the break was the summer break, so it's a big break. Yeah. So yeah, you already said your tips. Congrats again for getting through, and now we're at the next steps. So maybe we can start off with well, there's 2 main questions to go. I'm just looking at the time. Yeah, we're doing all right. We're at 1 hour, halfway through. So let's go with the first part, where what would you want from a mentor? Because I remember at some point you reached out to me